How long is the recovery from a tibial spine avulsion? I'm Dr. David, orthopedic surgeon and sports medicine specialist, and I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Most people have probably not heard of a tibial spine avulsion unless your kids have suffered one. Basically, it's the equivalent of an ACL injury, but it typically occurs in younger kids from about age, I guess as young as 8, but it's really about 10 to about 15 years old. The ACL attaches to the top of the tibia at basically a little bony prominence called the tibial spine. And instead of tearing the ACL in the middle of the ligament like what most high school, college age athletes and adults do, as younger kids, you can actually pull that tibial spine off of the tibia. And in young kids, you can actually fix that surgically. So how long does that take to heal? And we're going to talk about that today in our Ask Dr. Geier segment. Shari asks, my 7-year-old son had a tibial spine fracture with an avulsion. He had the ACL reattached. How long is the recovery usually? I was told maybe no soccer for 9 to 12 months. Does that sound realistic? And I would probably say, Shari, that that's fair. So what you're doing, instead of an ACL reconstruction where you take out the torn ACL, you drill holes in the bone and pass a tendon graft into it to make a new ACL, this is much more of a true repair, where you're basically taking stitches usually and reattaching it to the, you put the stitches through that bony piece, pull it down onto the bone and anchor it with a button, or there's various ways to do it, but you're reattaching it. You're not making a new ligament. It still takes time to heal. It's a lot less painful, I think, than a reconstruction, but it might be a little bit shorter recovery. I'll tell you, I wouldn't count on that though. You're still so dependent on that ACL, and you've got to make sure that tibial spine is completely healed. And then you're still having the same battles with getting the knee motion back and the strength back. That's probably a realistic time frame. I think overall recovery is still probably looking at 4 to 6 months. And yeah, return to sports may not, 9 to 12 months may not be unrealistic. I will say for a young kid, especially in this case, 7 years old, you want to take as long as you absolutely need to make sure that that does well, to minimize the chance that that young child needs a surgery in the future. Can't guarantee that for sure, but this is one, especially at that age, I would not rush a kid back to play. Let's face it, sports are just not that important at 7 years old. This is one you take the time to get over it. And repair of a tibial spine avulsion, reattaching the ACL and that tibial spine has good success rates, but you have to do whatever you need to do to get that to completely heal. Okay, I know you may not have heard about it, but if you have a child that has had a tibial spine avulsion, how did he or she injure it? And what was the treatment? Did he or she have surgery? And how long did it take to recover? I would love to hear that experience, and I know readers that are dealing with this problem, or viewers I guess I should say, all over the world would love to hear your experience as well. So below this video, share your experience so that other people can learn from that insight. And if you have had a sports or exercise injury, or maybe one of your family members had, and you want my perspective on it, send those my way and I'll try to answer them in a future Ask Dr. Geier video. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page. You'll get these videos delivered. I do a couple a week and you'll get them delivered directly to you. Thank you so much for watching. I hope this was helpful, and I look forward to seeing you right here next time.